Okay, so we're going to get started. So welcome again. Thank you for your attendance. We are here today for our first Medicaid mini, Adding Medicaid, Your Practice, Your Way. I am Jessica Emmerich, your Medicaid mentor and the Dental Medicaid Facilitator with the Missouri Coalition for Oral Health. We've partnered with the Missouri Dental Association and MoHealthNet to provide you all with enrollment, credentialing, and billing support. MCOH is a 501c3 advocacy organization. We're focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about MCOH and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. So at last count, we had 128 registrants from across the state representing both currently credentialed providers at 63 and 66 of our registrants are considering credentialing with MoHealthNet. I want to let you know that we are here to meet you where you are and support you through the process. Today, we are going to focus on the strategic business aspects of adding Medicaid to your practice. Our session is being recorded and will be made available to you after the session. During the webinar, attendees are muted, but you can submit questions in the chat or question and answer box. Both of those are at the bottom of your screen. We will keep our presentation to the point and address your questions directly at the end of the presentation. So with that information, let's go ahead and get started. Adding Medicaid, Your Practice, Your Way. All right, so new Medicaid dental rates went into effect July of 22. Which was a great opportunity for dental providers to start accepting Medicaid. However, we know that there are still challenges that dental providers are facing. And we know that because current dental Medicaid provider, the participation is low. Only about 16% of Missouri dentists are actually providing Medicaid services, and most of those are FQHCs. So to give you some numbers, there are about 940 dental Medicaid providers in the state of Missouri. And Missouri also has 1.5 Medicaid participants. So you do the math there, the math is not adding up, which means that most of those participants are probably not being seen by a dental provider and probably not having their oral health taken care of. One of the most commonly asked questions that I have received so far is, with this rate increase, is it going to last? How long is this going to be effective for? This is great now, but what's coming up ahead? I want to reassure dental providers that we do not anticipate the rates going back down. It would be very, very unlikely. It's actually more likely that we'd be able to advocate for more services or more rate increases versus going backwards. So I want to put that out there and go ahead and eliminate that fear that providers may have. These changes are here to stay as far as we are aware. Also, we talked about challenges, and I want to let providers know that part of my job is to work directly with dental providers to find out what other challenges are you facing. If you are currently enrolled with Medicaid and you have other issues and you have other thoughts and suggestions, let me know. Part of my position is to work directly with MoHealthNet and Missouri Dental Association to make this a better process for dental providers and make this a more workable system. So here's the good news for providers. We know there's a lot of myths out there about Medicaid. Medicaid has come a long ways in the several years. So one of the most common things is 1.5 million participants. That's a lot. We're not asking you to take on 1.5 million participants. We know that's not doable. Well, we are asking providers, can you take 20? Could you take 25? Could you take just a little sample of those to help ease the access for these participants and help make it easier on other dental providers? So you do not have to provide care to everyone. You can limit the number of patients you decide to care for. How can you limit that? You can say, I'm only going to take 20%. 20% of my appointment slots in my books are reserved for Medicaid patients. You can say, I'm only going to take patients under the age of 13. You can say, I'm only going to take participants that are referred to me from these pediatricians that I work directly with. You can make those limitations. What you can't do, you can't say, I'm only going to see Medicaid at 11 o'clock on Tuesdays. That would be considered discrimination. You cannot do that. But you can set limits in your practice. The state doesn't want to run your practice. They don't want to be involved with every aspect. They just want you to see their patients. So you stay in control. You get to decide how many of those patients do you want to see. As I hope you're aware, MoHealthNet does have 3 managed care plans. About 75% of the MoHealthNet participants are covered by the managed care plans, United Healthcare, Healthy Blue, and Home State Health. You do not have to manage, you don't have to credential with all 3 of them. You have the option to take one of them, take 2 of them, take none of them. That's your choice. You credential, you contract with the plans you want to work with, your choice. The main thing we're wanting to point out to providers is, in some instances, these rates are higher than private insurance. So I encourage you to go look at the fee schedule and compare the rates to what you're currently getting and what your office charges. These are workable rates now. Some of them are higher than other insurances. So go out there, do your research, look at the fee schedule, and if you have questions, please let me know. But you have options. You are in control of your practice, and we want you to run your practice the way you want to. Let's see. So back in April, Missouri Academy of Pediatric Dentistry and Missouri Dental Association conducted a dental town hall webinar. The goal of this webinar was to have providers hear from other providers how Medicaid actually works. It's one thing for me to sit here and tell you how it's supposed to work, or for even MoHealthNet to call in and say, hey, this is what we're supposed to do. This is how it's supposed to go. But being able to hear from other providers how it actually works in their office is very beneficial. So I encourage you, if you know of dental providers who are accepting Medicaid, talk to them, get their input. I think a lot of them will tell you it's not as bad as it seems. It's not as bad as it used to be. But this is a town hall webinar. It's about an hour long. I highly encourage our attendees to go out and listen to the whole thing. But right now, I want to play just a small 4-minute section of it from you. This is Dr. Emily Hahn. She is a special needs pediatric dentist in St. Louis. Also on the webinar were Dr. Aaron Booman and Ron Wilkerson. I was on there as well to talk about my position. But I'm going to go ahead and play this now. And she can tell you about her experiences firsthand.
So I was like, I'm going to find a way to do this, and I'm going to prove that you can do this. So what I did is I chose to work with only certain pediatricians and take their patients. So that self-limited my scheduling. And so that is something that is different with me against the other 2 guys, is that I do have a limit within my practice, and I place that limit before the rates increase, just because I wanted to see how it went, and I wanted to be able to keep my doors open. So my limitation is they have to be followed by a pediatrician within the building that I'm in. So that's a number, it's 13 pediatricians, and that's something great. And one of the number 1 myth I want to put out there, you can limit what patients you take. The limitation you cannot have is what time of day. So you can't be like, oh, I'm only going to take Medicaid at 11 a.m. You can have discrimination in that way, but you can have limitations in the number of new patients you take, the number of your panel, and a lot of people do age as well. So some people say we will not take new patients based on their age. So you can create your own requirements. So that's something that I want to like scream from the rooftops. At Children's, we only take medically complex kids. So there are limitations so that you don't feel like someone's going to, like steamroll your everything. So just know that. Another thing is the question that I saw was no shows. My thing is if you create an environment and develop a relationship with your patients, they show up. I think that there's been a lot of these patients have been burned before because they go to the stereotypical Medicaid clinic where they don't feel as if they've been treated like people. And when we as providers and our teams learn to just treat people like people, they show up. And so I'm sure each of us will speak a little bit more on that, but that's just my 2 cents on that. I do a lot of general anesthesia. We actually spoke about codes and things like that. my team has found pre-authorizations for Medicaid is substantially more straightforward than those who have private insurance. It's a lot faster turnaround. And what's interesting is Straight Mo Health Net and UHC Community, you don't need a pre-authorization, whereas the other two you do. So I don't do this day in, day out, but I know those nuances. They're not that complicated. Another thing is enrollment. This is why it is so nice to have Jessica, because when I first opened in 2019, it was me personally trying to figure out who the contact was from each place. And it was literally, I was chasing my tail because they would change who it was, but now we have Jessica. So please talk to Jessica to help you with the steps along the way. She's the perfect resource for that. And then as far as billing, the one thing that I think is really nice is I don't have to go for collections with my Medicaid population. So we can present what's best for the patient, and the parents don't have to say, oh, I can't afford that. I can present a treatment plan. We don't have to go through the fees. I don't have to feel like I sell dentistry, and I can do what's best for the patient. And it is awesome in that capacity. I originally, when I first opened, I limited the percentage of Medicaid that I would see a day because, again, the fees were so much different. But right now, the fees are significantly more than some of the insurances that I'm in network with. And I get that fee right away. I don't have to get it from the insurance and then collect from the family or do the background math. So because the systems so my staff goes directly through the portals to do all the billing just because it's a little bit more simple. But for pre-auths and predeterminations and for just to see what their enrollment benefits are, their timing to do check Medicaid is substantially quicker because they've learned to process it. And that's part of their daily routine, but it's actually more simple. Now, other states, not the case. So at the hospital, we work with other states' Medicaid insurances, and I will tell you it is not as straightforward. Missouri, however, is. So if you're talking to colleagues from other states, they're probably right. They're a mess. Missouri actually has their act together. So that's my 2 cents. I'm excited about this, if you cannot tell, because we have an opportunity here to prove that healthcare can be accessible to everyone.
All right, so that was just a little snippet, and I hope that you will go back and watch the full webinar. Like I said, it's very beneficial. They have a lot of great information, and it's great to be able to hear from experienced dental providers who are taking Medicaid and hear how it works in their office. I think that's very beneficial, and it's a great resource that is available to you all.
So,
okay. So I wanted to make this short and sweet. So that we leave plenty of time for questions, because that is what this is all about. I want to know, what do you guys need to know? How can I help you? What are your thoughts about this? What can we do to make this easier for you? So here's my contact information. This is my direct email address. This is my direct cell phone number. If you call it number, it goes right here to my cell phone. I'm available most of the time, but please bear in mind, it does come right to me, and I'm only one person. And then this is the link to the Missouri Coalition for Oral Health website page, where we are housing all of this Mo Health Net Medicaid information. All of our resources, recordings of presentations will be there. Okay, so I want you guys to start sending me your question and answer. So in the chat box, in the Q&A box, let's get started on that so we can get as many in as we can. I do want to let you know, if you do have to jump off early, we are going to make the question and answers available along with the recording, so you can always look back through and see what other people's questions were. So one of the first questions I saw was about no-shows, and I think that Dr. Hahn kind of addressed that. As far as reducing the no-show rate, what I've been told by other providers who are accepting Medicaid is Mo Health Net isn't much different than other insurances. No-shows are going to happen. But like she said, building those relationships with those patients, and like she said, most of those patients have been treated like the stereotype Medicaid patient and don't have that relationship with the dental provider. So once you build that relationship, the no-shows are significantly less. So I hope that addresses it. Other than that, we don't have anything specific for that. I do want to tell you that you cannot bill for no-shows. That is one thing about MoHealthNet. You cannot bill for those missed appointments. MoHealthNet does provide non-emergent transportation to their patients, to their participants, so that they do have that available. So hopefully that transportation should be less of an issue. Okay, another question was where to actually find the fee schedule. I did provide the link, and it is available on our website as well. That's on the MoHealthNet page, dss.mo.gov, and then MoHealthNet providers, and then the fee schedule is listed there. There's also a question about the specialist services covered. Yes, not all the services were increased. It does list the specialist services. Those are included on the fee schedule. However, several of those were not increased at this time. That doesn't mean they won't be increased later on, but as of right now, those were not increased. But we were only able to increase the ones that were most widely used, most likely needed. So we know that's one of the issues that's still out there, and we're trying to help with that, but those things always take time. So please send me any other questions. Okay. We had a question of, can you set Medicaid days, like Monday, Wednesday, Friday is Medicaid, no time restriction on those days? Yes, you can do that. You can say Wednesday is my Medicaid day. Anytime on Wednesday, we can get those patients in. That gives them equal access, equal availability, access to your calendar. So yes, you can set those limits. Okay, what other questions do you have? I know that there are lots of questions out there, lots of myths. Anything we would like to discuss today about concerns or thoughts? Can you still see non-Medicaid patients on those days? It would depend on how you're writing your policy. Like this has to be, we suggest that most dental offices make this a policy that say Wednesday is their Medicaid day. As long as I would say the Medicaid patients have first opportunity to those appointments and then you fill in with other patients, I would assume that would be fine. However, you don't want to say Wednesday is my Medicaid day, but I'm seeing other patients that day too, so I actually can't get this Medicaid patient in for 4 months. That's where you just got to be cautious about that. We want to try to make that available to them if possible. And like I said before, talk to other Medicaid providers who are around you, and most of them are happy to share how they limit their patients when it comes to Medicaid, what type of restrictions, what type of requirements they have, and they can share more about their policies and processes on that. Okay, so the question is, who are typical Medicaid patients, kids, pregnant women, etc.? So typical Medicaid is kids, pregnant women, families, adults, seniors, special needs. So MoHealthNet really covers a wide variety of participants now. They offer a lot of coverage for a lot of different populations. We are going to cover more about the specifics of who those patients are and what services they receive in the next, next week it's credentialing. So the week after that, we'll go over which people are in which categories and what services they receive. But Medicaid patients could be a single working mom. It could be kids at school, seniors over 60, adults who are on limited income, pregnant women, nursing home residents. So covers a wide variety of people. So that's why we really want, that's why there's 1.5 million participants. And that's why there's such a need to have these patients seen. So we will dive into that more in session 3 when we go over that, exactly who's eligible and what they're eligible for. We got a few minutes left if anyone else has any questions. I did want to remind you, we are going to be sending out an email after the webinar. It will probably be early next week. It'll be a recap email that'll include a recording of the presentation and then the question and answers that were asked. Any resources that we discussed today will be attached as well. If you have specific questions and you'd rather, you can reach out to me directly. I'm available Monday through Friday by email, by phone, by text, whatever is easiest for you. Use those avenues to reach out to me and I'll work with you with whatever questions or concerns you may have. Like I said, I'm working directly with Missouri Dental Association and MoHealthNet to try to make this an easier process for dental providers. I have connections with the health plans. If you're having issues with managed care or have questions about managed care, I can help you with those. All right, Carmen, I got your question, and yes, I will give you a call. All right, well, we are coming up on our 30 minutes. We have a few minutes left. If you have any questions at all, please let me know. Please reach out to me or go ahead and ask them here. If you have questions, the other providers probably have the same questions. Like I said in our intro, with the attendees of these mini sessions, we're about split. About half of you are already credentialed and about half of you aren't. So if you're having a question, odds are other providers are having the same question. So please let me know and let me know how I can help, and we'll do what we can to make this an easy process so we can get these patients seen. All right, well, I am not seeing any other questions. So we will go ahead and wrap up today's mini webinar. We will do this again next week, Friday at 10:30. We'll talk about credentialing. So please join us again next week. It'll be the same Zoom link. It'll be the same information. That Zoom link will get you into all of the webinars, so you don't need to be looking for a new link each time. Again, if you have questions in between or you think of something later, please reach out to me. Please let me know. Share this with other providers, share this information, and let's work together and see what we can do to increase access to care for participants who need these services. So thank you for being here today. I really appreciate your attendance. If you have any feedback, suggestions, thoughts, please let me know. Again, my job is to work with the dental providers to make this a better process. So I need to hear from you. So thank you for being here today. I look forward to hearing from you in the future. Thanks.